This segment of CoastLife is sponsored by Beebe Healthcare.
Well, May is a great month because it's getting warmer. We have people coming to the coast of Delmarva. It's just a great time to plan your vacations, but it's also an important month.
Very much so.
Yes, May is American Stroke Month. It's talking about prevention and the prevalence of stroke. And someone who unfortunately knows what that can look like when you have a stroke is Dr. David Tam, and he is, of course, with Beebe Healthcare. Dr. Tam, thank you so much for being here. It's an honor to have you on the couch today.
Thank you very much and giving me the opportunity to talk about stroke.
Yes, thank you. So let's first talk, if it's all right, American Stroke Month. Just kind of tell us about what that is.
Well, it is one of the months where we talk about stroke, what it means, educate the public, and most importantly, talk about how to identify when you're having a stroke, because treatment is really critical.
Yeah, and you know that all too well. I'm really happy that you're able to share your story with us today. Can you just go into what happened to you recently?
Oh my goodness. So on March 8th, I know it was a Friday morning, I was really tired when I woke up, but I thought, hey, I'm always tired. And then I went to the office and had a little trouble talking. It was like I had like marshmallows in my mouth. And then after that, you know, I signed a lot of documents and I couldn't sign my name. It just, my hand wouldn't respond. It wasn't weak, it just wouldn't respond. And then after a couple hours of trying to figure that out and saying, oh, I'm just tired, or I slipped on my arm or something like that, I was going to a meeting and my assistant said, you don't look well, maybe you should go to the emergency room. And what Becky said really got me, who was my assistant, she said, if you don't go to the emergency room, I'll call your wife.
Oh.
So I went to the emergency room, and it turned out, I went in and I said, I think I'm having a stroke.
Wow.
And as a result, I got treated, got taken in, evaluated.
Wow. Yeah. And what happens next? I know we're going to get to what happens at Beebe when something like this happens a little bit more in just a couple minutes here, but what did that look like for you? I mean, you're running this hospital and this healthcare system, and now you're a patient there. What was that like?
It was really a struggle because, you know, I'm also a neurologist. And so you think, I should know. But it's really a challenge to really accept the fact that you're having a stroke.
Yeah.
And so you kind of go into some level of denial, and it's one of the really important reasons why I'm talking about it today, because I wasted valuable time, because treatment of stroke and how to get to the emergency room and get treated as fast as possible can actually reverse symptoms of stroke.
Wow.
And I didn't do that because I was just in denial. Thank goodness I was right around the corner from the emergency room near my office.
Yeah, made up for some of that time.
Yeah, definitely. So what happened next? What was your recovery like? I mean, obviously you're here today. You look and sound great, but what did that look like for you?
So, you know, it was a really challenging thing because I did everything the way any patient would do it. I didn't go in the back door. I didn't talk to a doctor. I went to the front and I was actually checking into the emergency room lobby. I think the check-in lady was very surprised, and I think she was wondering if I was testing her. But once I said, I think I'm having a stroke, that we went into the entire stroke protocol, which is something that Beebe has. We're a primary stroke center that's nationally recognized by all the emergency medical services. And within minutes, I had a CAT scan, angiogram. I was I can talk more about it, but was talking to a neurologist out of Jefferson Health Neurosciences, which we partner with, and the decision was made on how to treat it. And then because there was a concern about whether it was a clot, which we can talk about later, or actually a blood vessel abnormality, I got some medical treatment, but then I was put on a helicopter and flown up to Philadelphia.
Wow. Oh my gosh, that must have been scary for you, honestly.
It really, I think I was still kind of in a shock.
Sure.
And people ask me, well, how was that like? And my response is, I don't know, because I was on my back the whole time.
Yeah, that's true.
But when I got there, I was in the ICU for a couple days, and then everything turned out okay. There was some recovery that's gone on over time, and I was discharged.
All right. Well, I definitely want to hear more about the differences. I didn't know that there was different ways to have strokes, the differences in what you mentioned, and that partnership with Jefferson. So we're going to take a quick break, but Dr. Tam isn't going anywhere. We're going to be back in just a minute.
This segment of CoastLife is sponsored by Beebe Healthcare.
You're watching CoastLife, and we are back. We have Dr. Tam on the CoastLife couch. You saw him just a minute ago, and Dr. Tam, just during that break, you were really talking to us after sharing your story about your stroke, about how important time is. And you were even saying, I mean, you're a neurologist, you're a doctor, you even you waited a little bit to get help. Talk to us about the importance of time when you have stroke symptoms.
So I use the word FAST, which is what the American Neurological Society uses. FAST is for facial droop or facial symptoms. A is for arm or leg weakness. S is for speech problems. And then T stands for really time and how fast you get treated. Now, as you can see, I didn't have those classic symptoms, but that's one of the reasons why I spent so much time kind of in denial, if you will. Well, it's not really facial weakness, it's just some speech irregularity, or it's not really arm weakness, I just can't sign my name. But it's really important because if you don't get treatment, which starts with identification, within 4 hours of the onset of symptoms, your symptoms can be permanent. You can have permanent brain damage. Now, it turns out I was too late from the onset of symptoms. It just so happened that my stroke was one that recovered on its own with just some of the other kinds of treatments that we have. But it's really important for people to know that you have to get treatment as fast as you see these symptoms. Don't be in denial. Don't think that you're tired. Call 911 and get to an emergency room because there are treatments available that can reverse the symptoms of a stroke.
That's incredible. I never even knew that there was something that could reverse it.
Me neither.
Yeah, it's incredible how the technology is advancing, and some of that technology too is this partnership you have with Jefferson. I say technology because you talk to them through a screen. Tell us about that, because you had that consultation with them.
Well, it's really one that's both personal and professionally satisfying, because when I got here in 2020 as the CEO, one of the things we realized was there was not a lot of neurologists available, and you need a neurologist to be able to identify, evaluate, and diagnose and recommend that treatment. And so one of the things we did was we decided to have a partnership with Jefferson Health Neurosciences. And we got something called the Jefferson Emergent Teleneurology System, teleconsulting system. It's called the JET. And it is a robot, but it's not just a robot with a camera. It really helps neurologists come on right away from anywhere in America, but mostly in Philadelphia. Look at your CT scan and look at all your labs, talk to your other physician who's right here on site, and make immediate life-saving determinations.
Yeah, it really helps
and
with
so,
T and fast.
Who would have thought that the treatment and the program that we started back in 2020 was the one that actually saved my life in 2024. And it's really something that's quite amazing to me, because when I think about, even today, I have to tell you, one of the challenges of stroke is afterwards, even if everything comes out okay, there's still a lot of fear. Every time now I hear a helicopter flying over the hospital, I still kind of get a little choked up. Because there's a lot of anxiety, like, when am I going to have another one? What's going to happen next? What are some other things that can happen? Am I getting old now? Those are all these considerations that I think people have, and it's part of the fear that comes from the denial of I'm not having a stroke, because if I did, it means there's something really bad going on.
It's just a natural human reaction.
So what are maybe some of the causes of a stroke that maybe people could work to prevent?
So, really stroke is something that potentially could be preventable. There are certain risk factors. I have some of them. Diabetes is one, and I've been a diabetic since, I was 45, so almost 15 years. And my father had it, and I thought that I was managing it pretty well. Turns out I could have done a better job. So it's really important to go see your doctor on a regular basis and not pretend to be a doctor yourself and think you can manage it yourself. I think the other things are high blood pressure is a big one, and people always need to know what their blood pressures are. Go get it checked. Go get something that you can get online with, one of those electronic machines, and go see your doctor. These are all things, and in fact, we have a really great community health fair coming up, as we do throughout the year, where you can get your blood pressure checked. The other one is cholesterol. That's another area where you need to control, and so diet and then exercise. Those are all key factors and things that are risk factors for stroke.
And now, of course, we know it can happen to anyone. Can you, before we let you go, talk about the prevalence of it, and maybe if you have any numbers of stroke on Delmarva as well?
So, stroke is really one of the highest leading causes of death and morbidity in people in the United States. Here in Delmarva, it is like the #2 cause of morbidity. People really have significant problems. And you know, especially when you think about Delmarva being a place where there are older people, and then people love the idea of coming to live here and retire here. You can imagine the stress of being alone and being in your house, maybe with your spouse, and having a stroke. And then not just the stress of having a stroke, but then having to deal with the problems resulting from the stroke. These are all things that are really important and things that Beebe Healthcare really want to take care of.
Yeah, which you guys do a great job at.
Yes.
So, Dr. Tam, it means a lot that you came on here, shared your story, talked to us about this, because, you know, and we're glad, of course, your younger self saved your life a few years ago with the decisions you made with Beebe, and so that is in turn going to save so many other lives. So thank you so much. Don't forget, guys, just don't ignore the symptoms. Better to have them tell you there's nothing wrong, you're good, and send you home and have that peace of mind. So, Dr. Tam, thank you very much.
Thank you.
Thank you. All right, we'll be back in just a little bit. Coming up, you guys spill some tea, Leah.
That's right.
All right, looking forward to that.